in these responsibilities. It is my pleasure to welcome Minister Elliott and Minister Mulroney back to Southlake. The communities you represent in the ridings of Newmarket, Aurora, and York-Simcoe are also the communities that are served by Southlake. You have both been steadfast partners through the pandemic, and Southlake staff and physicians appreciate your ongoing support. I would also like to thank Mayor John Taylor for being here. The town of Newmarket has been a steadfast partner throughout the pandemic. Highlights of our collaborative partnership include working together to move our COVID-19 assessment center to the Newmarket Senior Center, and more recently, joining forces to vaccinate communities at the Ray Twinney Recreation Complex. Today's announcement is exciting news for the communities we serve in Northern York Region and Southern Simcoe County. So without any further delay, I would like to introduce the Honourable Christine Elliott, Deputy Premier and Minister of Health, and the local MPP for Newmarket, Aurora.
Well, good morning, everyone, and thank you very much, Arden, for your kind introduction. It is a pleasure to be in Newmarket today alongside my friend and colleague, MPP Caroline Mulroney, as well as the Newmarket Mayor, Mayor John Taylor. Thank you so much. We're here to celebrate some exciting news for our community. First and foremost, I would like to thank the incredible healthcare workers, the staff, the volunteers, and the leadership here at the Southlake Regional Health Centre for your heroic response to the COVID-19 pandemic and your commitment to protecting the health and well-being of all members of our community. I would also like to extend a special thank you to Arden for your incredible work in leading Southlake and our community through these very difficult times. Thank you, Arden. Whether it's caring for COVID-19 patients here at the hospital or helping to administer thousands of vaccines at Ray Twinney, every day the team at Southlake goes above and beyond to provide exceptional care to patients and families. I've heard several stories from our community about how welcoming you have been at the Ray Twinney Clinic. In particular, the family-friendly weekend you hosted in May not only made the vaccination process more available and enjoyable for our youth with ice cream and live entertainment, but your efforts helped the province reach the exciting milestone of administering 9 million vaccine doses that very same day. On behalf of our government and our community, thank you to everyone here at Southlake. Long before any of us had even heard of COVID-19, remember those days? I do fondly. Our government did make a commitment to build a comprehensive and connected mental health and addiction system for all Ontarians, including right here in York Region. The COVID-19 pandemic has only increased the importance of this work by accelerating the need for mental health supports and services. It's critical that Ontarians are able to access high-quality supports and services when and where they need them. That is why I am very pleased to announce today that our government is investing over $6.5 million to support the expansion of Southlake Regional Health Centre's adult inpatient mental health unit. On average, 17 patients experiencing a mental health crisis come to Southlake's emergency department each and every day. Currently, the adult inpatient mental health unit has only 16 beds. That means that the hospital inpatient program is often running at well over 100% capacity. This expansion will add 12 new mental health beds, increasing the total inpatient capacity to 28 beds and enabling the hospital to care for more than 400 inpatients each year, 400 additional patients each year. The newly renovated space will include private rooms, more natural lighting, and common areas to support recovery. It will ensure that individuals who need emergency mental health supports can receive the care they need when they need it and not have to wait. So I do look forward to being able to visit when the new adult inpatient mental health unit is completed, which is anticipated to be in late 2022. So thank you again to everyone who is part of Southlake for supporting our community during this time. Our government will continue to make the critical investments necessary to ensure that Ontarians have the appropriate supports to assist them in their journey to wellness. Together, we will build a comprehensive and connected mental health and addiction system for all Ontarians. So thank you. And with that, I would like to pass it over to my colleague and friend, Caroline Mulroney, Member of Provincial Parliament for York-Simcoe.
Thank you, Christine. It's great to be here with you and with Arden and Mayor Taylor. Today is a great day for the people of Northern York Region and Southern Simcoe County. As the MPP for York-Simcoe, I know how hard the staff at Southlake work and how devoted they are to their patients. Southlake is the health hub of our communities, and I commend the entire staff, doctors, nurses, custodial workers, and the many others who have gone above the usual call of duty throughout this pandemic. Last year, under the leadership of Premier Ford and Minister Elliott, Ontario released its Roadmap to Wellness, which outlined a path towards making critical investments throughout the province to fill the urgent gaps in mental health and addictions care, reduce wait lists, and address extensive wait times. That roadmap is what has led us here today. Southlake, like so many other hospitals across the province, serves many people on a daily basis and has an overcrowding issue as a result. This is especially true of the mental health program. Our government recognizes this and took action. By investing $6.5 million to support the expansion of Southlake's adult inpatient mental health unit, we are addressing the problems head on. There is no doubt that expanding this unit and adding more beds will make a real difference. These spaces will better address the demand for mental health supports and services in the community. And as Minister Elliott acknowledged earlier, things like bringing natural light to new private rooms will go a long way. These past 16 months have been challenging for all of us, but investments like these are meaningful and will make sure that the people of York-Simcoe are properly cared for. I want to thank my colleague, Minister Elliott, for not only her leadership, but also her commitment to the health and well-being of Ontarians. We have the right plan in place to make sure that people are safe, protected, and have access to the resources that they need. With that, I'd like to welcome back to the podium my friend, Arden Krystal.
Thank you, Minister Elliott and Minister Mulroney. The communities that Southlake serves in Northern York Region and Southern Simcoe County are among the fastest growing and the fastest aging in Ontario. Despite the challenges of being one of the most overcrowded hospitals in the province, Southlake staff and physicians provide leading edge care with compassion each and every day. This announcement and investment will help Southlake with our plan to expand our mental health program. Our mental health program continues to see dramatic growth. In the year prior to the onset of the pandemic, our emergency department saw over 6,000 mental health visits. Our adult inpatient unit had over 1,100 admissions, and our mental health clinics saw more than 33,000 outpatient visits. These numbers are expected to keep increasing in the months and years to come as a result of population growth and the longer-term implications of the pandemic. This new space will have private rooms, more windows with natural light, and common areas to support recovery and group therapy. Southlake's Mental Health Patient and Family Advisory Committee provided critical input into the design phase, which is so important to ensure we build spaces that are truly family and patient-centered. Better spaces lead to better healing, better experiences, and better outcomes. At Southlake, we like to say that we're by your side. This is especially true in our mental health program. I would like to thank the province again for this support. We look forward to getting to work on construction of this new space. And I'd like to invite Minister Elliott back up to the podium to take some questions. Thank you so much.
Currently, we don't have any media in the question queue. And just a reminder, if you do have a question, please press *1. And it looks like there are no questions, so that will complete the announcement. Thank
How
you.
lucky am I? Thank you very much, everyone.
Thanks so much. Pleasure.